Yeah, it's less about the case as much as it's about the patient interaction. The case was pretty bread and butter for the urologist. It was a case of prostate cancer that was localized to the prostate, meaning that the cancer had not spread beyond the prostate itself. Um, and one of the treatment modalities, in particular for this patient, I felt that the premier treatment modality for him would have been surgical removal of the prostate. And I had been with this patient from his referral to Georgia Urology for an elevated blood test, which was concerning for prostate cancer. I did his prostate biopsy, and ultimately I did his surgery, from which he recovered excellently, and was cured of his cancer. But what stuck with me was more the interactions I had with him along the way. At every step of the process, there was a reluctance to go forth with the recommendations, not just that I made, but that were in national guidelines put forth by urology societies. And he told me at the end of all this that he probably would not have gone forth with anything that I had recommended if I hadn't just taken a couple of extra minutes to get to know him, get to know his family members that frequently came with him to the appointments, and at every step of the way trying to meet him halfway. And what stuck with me about the case was just that it taught me that my job was to do more than to be a medical professional, a surgeon, or just a technician. It taught me that my job was to get to know patients and to explain to them the problem that they present to me with in the context of their own lives.